It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good Saturday afternoon on an absolutely beautiful fall Saturday afternoon. I believe opening day of duck season. Seeing a lot of pictures up where folks are out getting their limits. Congratulations on that. If you're out in the woods hunting, we hope that you're having a great day and be careful if you will. Been off the radio for a couple of weeks due to OBU football. Want to congratulate them on a great game last weekend, great season. But glad to have you joining us back here on the Kim Hammer Show again. If you're interested, you can go up to my website at thekimhammershow.com, thekimhammershow.com, and you can find informative content as far as daily activities, things that are going on that are of interest if you're conservative by nature, and just encourage you to go up there and check out the website. Also, if you're a business or individual who'd like to help host the show, you can go up there and leave a message for me. I'll be glad to contact you and would appreciate any support that you can do in that area. Want to wish you a happy Thanksgiving as it's coming up this week. And in spite of everything going on in the world and in our nation, we still have a lot to be thankful for. So please don't forget to thank the Lord for all the blessings you do have in spite of all the challenges that are in front of us. But we will persevere and we will endure. So hang in there. And we will try to get this thing righted as time goes on. I'll have joining with me on the show here in just a minute, Attorney General Leslie Rutledge. We will be talking about the two lawsuits that are going on regarding the vaccine mandate. Yesterday in Legislative Council, about 3 to 4 hours of testimony from DHS and from UAMS and other institutions regarding the decisions that they're making regarding the vaccine mandate that has been imposed by the Democrat Joe Biden. And we're going to be talking about that in just a little bit. I want to kind of read a couple emails that I've gotten. I'm going to depersonalize them a little bit just out of respect for the people that have sent them to me. But I want to give you a little bit of context of what we're dealing with. One of the things that, quite honestly, I do find disturbing is that over the last 2 years, we've had individuals that have been on the front line in the healthcare field that have been giving of themselves tirelessly. A lot of them have put in long shifts. One of the things that's kind of added insult to injury is that you have the healthcare workers that have been working prior to the pandemic and worked through the pandemic. They were working for just their regular wages and working for what they had agreed to long before the pandemic came on. When the pandemic came on, there was a need, or there was some justification in some people's mind to have to hire agency staffing, which I have nothing against agency staffing or those that work for agencies for that matter. But you had individuals that were coming in and that were working and getting paid an enormous amount of money, working alongside those that had been there before the pandemic, through the pandemic, and are willing to stay after the pandemic. However, now many of those people that were working on the front line and were faithful through the pandemic basically are being thrown to the curb. I have a problem with that because these were people who remained faithful throughout the time. I respect the fact that people have made decisions to get the vaccine. I've gotten the vaccine. All my family has gotten the vaccine. But by the same token, I feel that based on the science that has been proven, or that science that has been given in some of the guidelines by CMS that has allowed for the antigen testing to be sufficient and also for weekly testing to be sufficient, I believe that those need to be incorporated into the discussion. That's why I passed a piece of legislation that would say that it would require all employers, regardless whether you're a healthcare employer or whether you're a regular business, that you would have to provide that if you were an employer that was either forced to mandate it, such as what Joe Biden, Democrat Joe Biden, is trying to do or has done, or you chose to do that yourself, because those were things that were allowed in the CMS guidelines that were passed out. Of course, we know that CMS changes its mind about like the wind changes directions, which is added to the confusion as well. Nonetheless, those were acceptable policies that were put out in the CMS guidelines, so we created legislation. Unfortunately, could not get enough support on the Senate end to put the emergency clause on it, and as a result of it, that law will not go into effect until January 14th. The reason it won't go into effect until January 14th is by Constitution, any piece of legislation that is passed without an emergency clause has to sit for 90 days to allow the citizenry to be able to raise objection and to be able to have a process to overturn a bill or a law that we pass that they don't agree with. And so that's the reason for the 90-day. Unfortunately, and the phrase that I use, and I think that based on current activities of this past week, which Senator Garner is going to be joining me here in just a second, he's on the other line. Unfortunately, what we find is the phrase that I used when I presented the bill, and also the phrase that I used yesterday in comments regarding ALC, is it's open season on employees who stood faithfully throughout the pandemic and do not want to take the vaccine are now fair game as far as employers being able to terminate them, including healthcare providers. And we are beginning to see the pattern occur where healthcare providers are sending out mandates, if you would, to the employees that they have until December 5th to receive the first shot. And if they do not do it and they're not fully vaccinated by January 4th, which is 10 days before the bill that I passed goes into law, they are going to be terminated. What adds insult to injury is that they voluntarily terminate, which means they won't be able to draw unemployment unless we can get something done or we can push something through. Unfortunately, the reality is that people are going to be losing their job in the healthcare industry because they are being forced to choose between their personal conscience, which is a constitutional right, or having to take the vaccine. I told you that I took the vaccine. All my family has taken the vaccine. That was our personal choice. But some of us believe that by constitutional right, if you choose not to, that you ought to be afforded the full effect of the law to protect you in order to keep you from having to take it. Joining me on the line is Senator Trent Garner. He passed one piece of legislation, which is Act 1033 or 1030. Straighten me out on that, Trent. Act 1030, is that the one that you passed?
Yes, sir. Well, thank you, Senator Hammer, for having me on today, speaking to people of Central Arkansas. I always enjoy talking to my good friend, Kim Hammer, and excited to talk about 1030 and what it does to add protections and how I don't think people realize that law is in effect and how I think it can protect people from having that personal medical freedom when it comes to employment or other options.
If Senator Breanne Davis is able to join us in about 15, 20 minutes, she is driving to her mom's with her 4 kids. She's going to try to join us because she will talk about Act 977, which is, she was the Senate sponsor on that. Robin Lundstrom was the House sponsor on it. And then the act that I passed was Act 1115. And what I want to try to do is let's try to blend all these together, and we'll hit the pause button when the AG calls in to get her in, because I want to talk about the 2 lawsuits that are ongoing with her. But
Absolutely.
Let's start off by letting me have you tell the audience Act 1030 does what, number one, and number two, how does it blend with Act 977, but yet how is it different? Because you brought that up on the floor yesterday in discussion in ALC, and go ahead and just and share about that.
Yeah, the reason this bill is passed is because the bill that Senator Davis and Representative Lundstrom were working on was a great bill, but it had a kind of uphill battle to pass. There's multiple amendments done, multiple discussions, and while that was happening the whole time, I knew that vaccine passports were the likely future in a number of different ways, and I wanted to file legislation that would prevent that documentation, the proof of vaccination, for multiple things in our society. But I intentionally waited until Senator Davis and Representative Lundstrom bill passed and was signed into law before I kind of ran mine as kind of a backup. Their plan was always going to be the first step to the next step, and then we got your bill later on, Senator Hammer, which is a great bill. But what my bill does that distinguishes from 977 is 977 has that you basically can't require vaccination. And if you do for, say, a healthcare facility like UAMS, you have to come to ALC and get approval. That was that process we went through yesterday. My bill actually is different in this key regard. It has no opt-out where they can come to ALC and actually discuss it. But more importantly, it's not actually stopping vaccination. What it's doing is stopping the documentation that shows vaccination. So UAMS, even if they say they're going to vaccinate their people, under state law, it is illegal for them to ask that you give documentation to prove that. So if they even get approved by ALC under state law that I passed, it would be impossible for them to ask vaccination status without violating law, thus being unable to comply with the CMS and other rules and firing people because of that. So if I'm an employee, if you're listening right now and you're an employee of UAMS or another state facility that requires this, or a state agency like DHS, if they ask you for that documentation, you have a right underneath the law to deny that, and they cannot compel you to do it.
Okay, but let me ask you, because this is, this is a concern, and I've got emails, you've got emails, every legislator's gotten emails. One of the concerns is, and it was brought out yesterday, is if that is a state law, why is UAMS, and let me just clarify, and you straighten me out, the reason UAMS is at the center of discussion is because UAMS is a state institution. We're not talking about Baptist Health, Saline Memorial, or any of those others, because those others are private entities. Now, they are following suit. In fact, Saline Memorial down in Benton, I got an email where, as a result of UAMS's policy, they are following suit to do the same thing as UAMS. I will give it credit to Dr. Patterson that at least they are trying to be very accommodating under the religious objection and trying to do everything within their power to give their employees that option. I think you or Alan Clark brought up about, kind of late to the game on this one, given the time frame that we're working on. But nonetheless, I do want to give credit where credit is due. But with your law, because you raised this question yesterday, and the chair ruled that there was, I think I'm right on this, straighten me out, the chair ruled that there was no conflict between the bills. Therefore, your point about UAMS being in violation of the law was not valid. Speak to that point for a minute, because if they are in violation of the law, what are the consequences of them being in violation of the law, and how do you stop what's being done using the law that's on the books?
Well, first, Act 977, which you mentioned, I'm sure Senator Davis will talk about further. I believe they violate that law because they did put in a vaccine policy before they came to ALC and got approval. They put out an email basically putting one in place, and by the letter of the law, I think they violated it without approval of ALC. But forget that. What my bill does is they cannot prove that documentation to prove vaccination. So they ask for your vaccine card. By asking it as a state entity, they have now violated the law, which means if I'm an employee and they ask for my vaccination status, I will tell them I'm not going to provide you any documentation, and under the law, I don't have to. If they fire you, I think you have a cause of action, because under that, the law protects you from doing that. They're violating state law. You take it to court, and a judge, assuming you get a good judge who's fair on the law, will rule that no, they're not allowed to do that and ask for that documentation. And if they can't ask for that documentation, they can't prove your vaccination status one way or the other, which I think is a kind of a way to protect these employees listed. Now, your point about Baptist and other facilities, that was originally part of my law, is that private businesses would be included as well, and under the vaccine passport. And as you very well know, there was a huge fight brewing over that. And the reality is, at that time, I didn't know if it could pass because we hadn't seen these vaccine passports become as mainstream as they had whenever you presented your bill during the second session. And so I took that part out, even though I do believe the rest of my law applies to private businesses. Say if you go to a private business, they require a vaccination to go in. Underneath that law, I think you could be sued. But for the state entity, 100% they're included, like UAMS, but private or non-state entities, health medical facilities, unfortunately, they're not going to be protected until your law goes in effect in January. And so that's an unfortunate part. People have asked me, what if they receive state funding, some other caveat, and unfortunately, I don't see any way in the law where they're protected right now outside of your law going into effect at beginning in January.
Well, and that was one thing did ask the Attorney General's office yesterday, I think, or Dr. Patterson was, our DHS, it was DHS when they were sitting at the table. If you have providers, because youth homes yesterday, I got word from an employee that youth homes yesterday sent out the notice that if you're not vaccinated by December 5th, you're going to be terminated. And I guess that was the question I was asking DHS, is that if all these providers down the line are receiving Medicaid funding, why wouldn't your law apply to those that are receiving Medicaid funding, even if it goes through DHS as a pass-through, because ultimately it is Medicaid funding? Why would that law not carry down the stream to pick up those providers that are now telling their employees that are providing services to Medicaid patients that you're going to be terminated if you don't get the vaccine?
That's a fair point. I'd have to examine the law and kind of, it's very straightforward law, and have to look at the mechanisms of how that works. Maybe if it's going through DHS and they're using kind of the the arbiter of how that money is done, that could be applicable in that situation, and that needs a good, I think, lawsuit to come up. But let's just talk. I mean, let's just talk about the human cost of this. Like, I'm hearing from some facilities that are in the nursing home, assisted living facilities in South Arkansas, and I'm hearing from them that some of their facilities, they're at 30 to 40 to 50% of their people are not vaccinated, and they said it will be impossible for them to vaccinate the people that will actually hold those positions by that time. So you're talking about in rural South Arkansas, where I live, that I know you have plenty of experience with. There aren't a nursing home or a facility you can take your grandma or grandpa on every single corner. These are very rare in South Arkansas, and they're very well needed. If those places shut down because there's requirements for staffing X amount of patients or per nurse or per assistant, you're going to have some severe problems. And that's why I think this Biden unconstitutional mandate, whether it's coming from CMS, whether it's coming from OSHA, it just has to be struck down. And we, the state, should fight back to the last possible second. And I said this yesterday, Cam, and I'll say it again. I think there's a 0.00% chance that Joe Biden will actually take $1 of funding. One, Joe Biden has never been shy on cutting. I never really wanted to cut $1 of federal spending ever. Secondly, you're talking about multiple states who fall underneath this rule, and you have literally billions of dollars taken out of our economy at a time when his poll numbers are cratering. I think people in Texas who have a law similar to ours, or Tennessee or Florida, may remember that the next election. I think there's going to be severe consequences if he tries to do that. So we as a state of Arkansas needs to push this as far as possible, because I'll finish up with this. As you said, last year and a half, we've had our healthcare workers be the heroes. I mean, they have been out there on the front lines. Some of them have gotten sick, died, working late hours. I got an email from a woman who works at a labor unit at a hospital talking about working multiple 12-hour shifts with one break for 30 minutes and been doing this for months. And now those people are facing being fired for making a personal medical decision. And honestly, if we're as a state, whether it's legislators, whether it's the governor, whether it's the attorney general, if we don't stand up for them, I really don't know what we're doing in this job. It's something we have to do. These are our heroes. Let's not turn them into zeros and make them have to go to the unemployment line whenever we need them so critically in Arkansas.
Well, first of all, unless you're about to go out in the duck blind, which did you have good success this morning?
Anytime you're in the duck hole, you're having good success. We killed a couple, but it could have been a lot better. It could have been a lot worse. But yeah, I got time to talk if I can get me to stay on.
Yeah, I need you to stay on because Leslie Rutledge did send me a message, and it's going to be about 12:30, so maybe after the break. And I respect her schedule and I respect her time, and I appreciate the message. But this is one of the things that's a little bit of a gripe about mine. We as a legislative branch, not in its entirety, but the majority, and that's all that matters, is the majority stood together and held the line, and we got legislation through, such as your act and Senator Davis and Representative Lumstrom. They worked together on their act, and then I got my act through. We all had our act together, no pun intended, but we held the line, and the majority of the legislature said, we're going to protect you. Now, some of the bills went through with the governor's signature, some of them didn't. That's not mine to explain. But the reality is that if the medical provider group as a whole will stand up and will help us stand up to the Biden administration, it'll communicate a stronger message. I know they are fearful that they're going to lose their Medicaid funding and their Medicare funding, but as you and Senator Clark pointed out yesterday, the reality of that is less than a percent. That's not significant, and that's part. I'll be honest with you, that's part of what irritates me, is that the medical provider group is not standing up with us and saying, you know what, we respect what our employees have done, and if it was not a proven method that you can have the antigen or that you would be willing to submit to weekly tests, it'd be one thing. But the fact that that is allowable, but yet not permissible by the mandate, I think the medical provider groups need to be standing up with us as legislators and saying, we're not going to take this, and we're going to stand together.
100%. I mean, let's lay it out on the table. And the same thing with the OSHA rule coming from Biden, what you said a year ago he couldn't do, but that's irregardless. If our medical community is going to allow CMS to put this rule in place through the way they did, through an emergency order with no public comment, then imagine what the next step will be. I mean, we always talk about the slippery slope. Well, Kim, we're sliding right
We're
now.
on the slope.
I mean, we're on the slope. You are absolutely right. What's the next rule they're going to put down if we don't stop this one? Will it be, hey, you have to provide abortion at your hospital? That sounds crazy, but it's not. Do you have to do all these other issues coming from the federal government? And there will be some issues, whether you believe in vaccination or not, whether you think every employee should be vaccinated. The next step to the next step will eventually to a point that it hurts you as a healthcare provider or hurt your employees. And I just do not trust the Biden administration or any future federal administrations not to abuse that CMS rules. We've done this before, as I mentioned yesterday, the Medicaid expansion. They tried to cram that down our throats, and the courts came in and said that's optional. They threatened to cut funding over that, and it didn't happen. I think this is a prime example of where these industries need to stand up, because if they don't, like you said, we'll be sliding, and we won't stop until we hit the bottom, and that ain't going to be pretty.
The one thing that was brought out in AL, and just for folks that don't know, ALC stands for Arkansas Legislative Council. It is the body that carries on the business whenever we're not in session. And it is made up of a significant number of legislators, obviously, that represent the majority of all legislators. And in the case of the law, that would be
977.
Yeah, 977. That had a component in it that said that if UAMS or any other state-funded institution wanted to seek a variance for the law, they had to come before ALC and get permission. And that's part of what that was all about. Then Senator Garner's bill said, well, you've already broke the law by the fact that you put the policy out, which that's one thing I think Senator Clark did yesterday, and you and maybe Gary Stubblefield. You outlined the timetable of which all these messages came through that showed that the policy had already been put in place. And I asked for the policy yesterday because I want to know what's the date of the policy on the religious exemption and the other things, so you can build the timetable to see where that went through. The effectiveness of ALC as far as that, what we did, if you remember, Trent, or you can outline, I'll let you do it, what we did yesterday as far as postponing the decision.
Yeah, so yesterday was basically would come up for a vote. Do we allow them to create a vaccine mandate at UAMS? And I assume DHS and the Department of Veterans Affairs there for the same reason. I left before those because I know the motion changed all that. Well, if we allowed that or not allowed it was kind of how the decision would be made. And what we said as a legislative body through ALC yesterday was it's premature to even make a decision on this because we have multiple lawsuits in the works across the nation that will likely stop this from being an issue. I'm sure the Attorney General, when she comes on, will explain in much better fashion, but I'll give you the quick rundown. The courts, so far, in my opinion, I'm an attorney, are very, very, very suspect of all of these mandates. And I think at the very least, they'll put injunctions on them to pause while they go through it. I think the Biden administration knew this, by the way. I always thought it was a political ploy to actually, they didn't think they would stand up in court, but that's irregardless. And so we as a state were like, why do we need to set a vaccine policy for UAMS or anybody else, since we're not actually at the point where funding will even be threatened to be cut? And why not wait to the last possible second before you even have to make a decision on that? Usually I'd say that's punting for a decision down the road, but in this case, it's actually the opposite. It's being prudent to make sure that we don't set a precedent of putting vaccine mandates in place before we know how the lawsuits will work or before we take this all the way humanly possible. And like we're sitting at that day, and it's like you're going to lose $600 million from your AMS tomorrow, and we have actual concrete proof of that happened. I don't think that's going to happen, and that's a decision we'll have to make. And I think a lot of people will take that seriously. But we are so far from that point. I was proud to see the legislators not fall into the pressure or the kind of political talking points that we're going to lose this money today if we don't do this, and actually say, no, we're going to do the prudent thing. We're going to wait, and we're going to stand for the people as long as possible. And so that was a good day for the Arkansas legislator and the people in general.
Right. And when I began to question Dr. Patterson regarding the time frame, because they are trying to give people religious exemptions, which the reality of the matter is the time to do that in, and we're going to take a break, so hang on and we'll come back afterwards and we'll pick this up. But I want to talk about the timing of which it's November 23rd. Let's do this. Let's take a quick break. Leslie Rutledge is going to be joining us right after a quick break. And Senator Garner, if you can hang on, we'll pick up if you can hang on. This is Kim Hammer Show. Yeah, all right. I'm getting talk from John here. We're going to go ahead and take Attorney General Rutledge now because her time schedule is pretty tight. Attorney General, thank you for taking time to join us on the Kim Hammer Show today.
Hey, how are you, Senator? Always glad to be on with you.
Thank you. I've got Senator Garner on the other line, just so you know, if you've been out of signal. But I know your time is precious, and we appreciate you joining us on the Kim Hammer Show. So let me kind of. Did you go duck hunting this morning by any chance?
Oh, I wish I did. That was not in my stars, but I wish I had. I've seen some great pictures already of some of our friends and some of my friends and family and people out there enjoying a beautiful fall morning in Arkansas for opening day of duck season.
Very good. All right. Well, let's get to the business at hand. Number one, there are 2 outstanding lawsuits. Update us on the OSHA lawsuit, and maybe give a quick synopsis of your involvement in getting involved in both the lawsuits, just so people have an understanding of what your involvement is.
Well, absolutely, Senator. And one of the things that I've done as the Attorney General with regard to President Biden's overreach as it pertains to the vaccine mandates. You know, we've got a federal government that is just beyond out of control. In Arkansas, we joined a lawsuit suing the federal government over the OSHA vaccine mandate. There are 3 lawsuits, so keep this in mind. There's 3 lawsuits. There's the OSHA lawsuit, vaccine mandate, there's the federal contractors lawsuit, and there is the CMS lawsuit. And so the one with regard to OSHA, which says that if you have 100 or more employees, you have to have them vaccinated by first of the year. And so we sued, but there were several lawsuits, and the one out of the Fifth Circuit, which includes Louisiana, is the one that put the stay in place, but it put the stay in place for all states, and we are so right now the vaccine mandate is not being enforced by OSHA. So that was a huge win. Arkansas was part of the cases, and again, just a huge win.
All right. What about the second one, the federal contract?
All right. Well, that one is also. Well, let me get to all my notes so I tell you exactly where they are on all these. So the federal contractor, in late October, we filed that lawsuit against President Biden's administration requiring vaccine mandate for federal contractors. We also filed a motion for a preliminary injunction at federal district court to halt that mandate. The case is being fully briefed this next week. Essentially, what we're arguing is that it's an unconstitutional mandate, and it requires our federal contractors to be in compliance. It's a rushed and unrealistic time frame. It's set aside that January 2021 that all federal contractors would have to be vaccinated. And again, this is we're in the what's called the briefing stage of this, and so the court has not decided yea or nay yet. But we did ask for the court to put a preliminary injunction on that.
And with that, I guess you would hope that preliminary injunction would also be for all 50 states as well, but mainly Arkansas. You represent Arkansas.
And we do. And what happens with these, Kim, when Arkansas files a lawsuit, or you see if Texas or Louisiana, you know, I was actually surprised when the Louisiana case that went up to the Fifth Circuit on the OSHA lawsuit, we'd gotten that stay against the vaccine mandate. OSHA had, the courts had said, no, you can't go any further, OSHA. You can't enforce this right now. So many Arkansans were texting or emailing me saying, I wish you would do the same thing, where we had. And so I'm going to encourage I appreciate you covering it here on your program, but I'm going to encourage other members of the media to cover more thoroughly when Arkansas is involved in cases. I kept reading in our statewide paper where it would talk about the case that Arkansas was involved in, but we would be, 14 paragraphs in. And when Arkansas is involved, our Arkansas News, I encourage Arkansas News to do just what you're doing, and that's cover Arkansas News when we're involved in a lawsuit. So that way Arkansans will know that the folks, the team at the Attorney General's office, we're fighting for them. We're fighting to make sure that we don't have overreaching government regulations from the federal government.
Right, which you are involved in all three of the lawsuits.
We are, absolutely are. We were from the onset. We knew. Another question I keep getting asked is, Leslie, why don't y'all, what took so long? Well, the reason why we didn't file as soon as the president announced he would be doing this is because we had to wait for it to be essentially what they call ripe. And that's ripe, kind of like a banana gets ripe for you to eat. When it's green, it's not a good time to eat a banana, but when it's nice and yellow, it's time for it to be ripe. If it gets brown, it's what they call moot in the law. And so when the case is ripe, that's when we can sue. And it was once the OSHA rule was published, officially published by the federal government, is when we were able to file that lawsuit. And all of us filed that lawsuit immediately, within hours of it being, of us being able to, we filed that lawsuit.
Right, which until the rules came out, you knew there was a problem coming. You were positioning for it. But until the rules came out, you wouldn't know what to sue over because the rules had not yet been defined. And once the rules came out, or the banana got ripe, as you said, that's when everybody struck and joined together on the lawsuits. Is that a fair assessment?
It is. And even though we knew what we were going to be suing over, the courts would have said they would have thrown our case out. And so rather than wasting taxpayer money getting a case thrown out, we wanted to make sure that the time was right according to the law. And so as soon as the time was right when they published that rule for OSHA, and then we sued. And now, again, because of our work and collaboration with other states, we now have a stay put in place, and that rule's not effective. OSHA has said that they are not going to be enforcing that rule anytime soon.
Okay, the third lawsuit, which is CMS, because that's the one that affects healthcare workers that are being threatened with losing their job if they don't get the vaccine. What's the up-to-date info on it?
So last Friday, on November 10th, lawsuit on the CMS case, which, as you noted, requires many of our full-time employees, part-time, volunteer contractors working in a range of healthcare facilities, which receive Medicare or Medicaid funding. So that's a large swath of our healthcare providers in the state are impacted. We are hoping to get a decision in the next 2 weeks. So before the end of November, we're hoping to get a decision on that case. It really threatens our healthcare workers across the state. We've heard from tons of healthcare workers who, for one reason, whether it's religious exemption, whether it's health, whether they've talked to their own doctor, I do not want to receive the vaccine. And it's only going to make our worker shortage more difficult. If we are, a year ago, these folks that are nurses, our frontline healthcare providers, we were celebrating them in America, and we still should be. My dad had to go to the heart hospital the other night, and I anytime I go to a hospital with family or friends, I'm reminded of the Lord's work before our very eyes, because the patience, the expertise that these individuals have with our loved ones. And a year ago, we were celebrating them. Now, a year later, the Biden administration is forcing these same people to get a vaccine that they don't want, or perhaps they talked to their own healthcare provider, made the decision they don't need.
Okay.
That's going to force us to have a shortage.
Yeah. I hate to do this, but I've got to take a break or I'm going to lose my time on the radio. Can you hang on, or you got to go to your next event?
Well, unfortunately, Senator, I've got to go, but
okay.
I want your listeners to know that the Attorney General's office, we've already taken 60-plus legal actions against the Biden administration. We're going to keep fighting. We're going to keep working with our legislators like you, like Senator Garner, others, to protect Arkansans' constitutional rights against this administration.
Okay. I appreciate very much the time, because I know I wasn't on your schedule and you worked it in. And Trent, if you can hang on, I think we can finish cleaning this up if you can hang on. This is Kim Hammer Show. Be right back after a few-minute break. Thank you, Attorney General Rutledge.
Take The Answer with you anywhere with our free mobile app. 1011fmtheanswer.com. Your smart speakers, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM. The Answer.
Financial Issues has been around 25 years, and we've helped so many people. And it's a great way for you right here on 101 The Answer to call in, get some questions answered about what you might do for your retirement, for your savings, how you navigate through incredibly uncertain times. Oh, and speaking of the uncertain times, we talk a lot about that too. The politics of it, the economy of it, the craziness of it all. I hope you'll be with us. Financial Issues every morning.
From 8 to 11 daily, Monday through Friday here on 101.1.
So right now may be the perfect time for you to rethink how you pay for health care. And here's why. Not only is it time for open enrollment for a lot of people, it's also when you can join MediShare and save even more than usual. For the typical family, switching to MediShare saves about $500 a month, which is a game changer for a lot of people. Think what you could do with that. But if you join right now, MediShare is waiving their new member fee, so that's another $170 you'll save. And MediShare is really different. It's a community of Christians who share each other's healthcare bills. More than 400,000 people are members, and they've shared over $4 billion in medical bills. So yes, they can handle your bills too. This may be the time to make the switch. Join before November 30th for the additional savings. It's so easy to find out more. They're great to talk to. In fact, you can get a price within 2 minutes. Here's the number. Call 833-32-BIBLE. That's 833-32-BIBLE. 833-32-BIBLE.
There are many things to think about if you are buying a home or refinancing your present one.
Like, what's better, a direct lender or a mortgage broker? We like to think that a direct lender like Fellowship Home Loans is best.
As a direct lender, there is no middleman and endless requests for more documents. This could save you time and impact your terms and rates.
As a direct lender, Fellowship Home Loans can often close your loan in less than 3 weeks. Let's talk about it at 800-804-SAVE. That's 800-804-7283 or online at fellowshiphomeloans.com.
Regardless of your needs, Fellowship Home Loans wants to be your go-to source for home loans. Talk to a person, not a machine, at 800-804-SAVE. That's 800-804-7283 or online at fellowshiphomeloans.com.
Home is actually our middle name, Fellowship Home Loans.
Welcome home.
Intercontinental Capital Group, DBA Fellowship Home Loans, Equal Housing Opportunity Lender, MLS number 60134.
You want great deals? We've got great deals. DealsForLittleRock.com is your site for discounted deals on food, services, private school tuition, and so much more. Visit DealsForLittleRock.com and save. DealsForLittleRock.com. Get great deals right now at DealsForLittleRock.com. That's DealsForLittleRock.com.
To the Kim Hammer Show, and we've had Attorney General Leslie Rutledge, who squeezed me in at the last minute because this all came up yesterday, so I appreciate her squeezing in time. I very much appreciate Trent Garner, State Senator. Trent, I know you do not represent the Attorney General's office, but I also know you are an attorney, and I know that you're pretty knee-deep in all this, and you got a pretty good grasp on the understanding of the constitutionality of the challenge. So let me pick up where Leslie had to drop off and just ask you this. The 3 lawsuits that are pending, those are all based on constitutional challenge, not necessarily the emotions of what's going on. Can you speak to that?
Yeah, I mean, they all have different apparatus and legal structures around them. Say, like the OSHA ruling, OSHA having that authority with an Enabling Act, which Congress gives OSHA power to do certain health provisions. The courts probably are looking at that and saying, does this exceed the authority that were provided, and does this violate a constitutional right? The federal contractors are obviously different because federal money follows federal contractors, and the federal government can set certain standards versus what they can set for private businesses. And then finally, the CMS ruling is most interesting in all because you have the issue of, are they allowed to do this? And then I think more critical, especially for UAMS, is, okay, if they do this and we don't follow it, can they take away the money? And that's what we always talk about, Kim, and it's always interesting when it comes up in real life like this, is we always talk about not getting more entangled with the federal government when it comes to money, whether it's Medicaid, Medicare, whether it's Obamacare, whether it's this Build Back Broken plan they're trying to do at the federal level where you get these cradle grave entitlements. Because as soon as we do something the federal government likes, even if we as a state have the constitutional right to do it, they'll threaten the funding. And so that's what they're doing more importantly with the CMS, is saying, look, we'll cut your funding if you don't follow what we want. And so all 3 of those are different for the legal standards and how you approach them. But as we saw at the OSHA ruling, and I think we'll see with some of these other ones, they're all critical. And I think the courts are going to very much not respond well to this And you know who agrees with me? Vice President Kamala Harris and President Joe Biden, because months ago they basically said they don't have the power to do this. So hopefully the court follows their lead and strikes down all three. We're happy we got that win with OSHA. We need to continue on, and hopefully we'll hear from the CMS, federal contractors, and there's all kind of other lawsuits for like the military. Joe Biden set up his executive orders for these mandates intentionally to have multiple ways to try to enforce them. It was a legal strategy on his part. So hopefully we'll see them all get struck down, and that'll be better for everybody.
My opinion, although I've heard this expressed by some others, I think the strategy on their part all along was to do everything they could to force people to get as many mandated vaccines as possible, knowing that at the end they were going to lose, but they would get as many people vaccinated as possible, which doesn't do anything but put money in the pharmaceutical world, not your independent pharmacists. I'm not saying them, but I'm talking about the large pharmaceutical company because of all the money that there is to be made. Now, I want to be clear on one thing. I think the vaccines help. I think that people ought to get vaccinated unless they have a religious objection, which we'll talk about in a minute, or their physician has said you don't need to get this. The problem is these healthcare providers are striking down the religious exemption, and they are also striking down the medical, which what I don't understand is how can a medical provider say, no, we're not going to acknowledge your local physician's acknowledgement that you don't need to be getting this vaccine? What makes one any better than the other, better than your independent PCP? And that's part of the conflict that comes up in this.
Absolutely. Kim, can I interrupt you? I'm sorry to do this, but yesterday when we were discussing this, I looked up the CMS guidelines for what should be a religious or medical exemption. And the way they define it, and I think that's why you're seeing hospitals do this, is it has to be happen only in limited circumstances and can't happen unless it's protected by law, like the Civil Rights Act or Disability Act, or it's thought to be used for avoiding the vaccination. So CMS has come down and basically put this, okay, we're going to give you an exemption, but wink, wink, we're really not, because we have very strict guidelines on how to do it. So, UAMS, Dr. Patterson said, we're going to grant all of them. Well, if you follow the CMS rule, and that's tied to the funding, they say it has to be extremely limited. And I think that's why you're seeing some healthcare providers strike that down, because they're worried that CMS will actually come and say, well, you said this person was exempt, but we don't. We're taking your funding on that end. So they're kind of danged if they do, danged if they don't. And once again, I think there's a strategy by CMS, just like you brought up before, to say, we'll give you an exemption, but really we're not. And I think that's why you're seeing that happen. That's my kind of analysis of it. What's your thoughts on it?
Well, Senator Dismayne brought it out, and I think he was the first one to raise he said he'd stayed up the night before, in the previous week, and he was wondering how it is that UAMS or any other medical provider group could have any control over how they would individually write their religious objection policy. That's one reason I asked Dr. Patterson for the policy of the UAMS. I want to see how it's written, because you've got other institutions that are striking them down left and right. Is that because they just don't want to give their employees the option to get the religious objection, or is that because they really don't have any choice because their hands are tied by CMS? I guess a good lawyer will figure it out. You're an attorney, so let me ask you as an attorney, these employees that are having their religious objections turned down and the inconsistency from facility to facility as to how they are determining whether somebody gets one or doesn't get one, does that set it up for class action lawsuit where employees have been denied their religious exemption or even denied their medical exemption are able to file suit because they have been unfairly disqualified or discriminated against?
I believe so. I mean, I think that if you can tie it to either say something like the Civil Rights Act, the First Amendment, your right to practice your religion, you're tied to multiple other statutes that we have that deal with your personal protection for religious or medical issues. I think there's a potential to do that. Now, what the employers will say is the federal government's forced us to do this, and that's kind of true. And that might complicate things as far as that goes. But listen, I can tell you this, and you know this, Kim, everybody across the state and everybody across the nation right now are trying to find any way to attack this. So if there's a legal strategy for an attorney to do that, I think it will happen. And once again, I hope it's successful in court. And let's go back to one point you made, if you don't mind. You said, you think Joe Biden's strategy is to do as much as possible to try to get people vaccinated. And when this is thrown out, say, well, that's it. I think that's very well intentioned. We saw this before with the eviction memorandum, where they basically said, no, you can't evict anybody, even though they had no authority to do it, and they pretty much knew it'd be in court. The reason why they did that is because it gives them political win to say, hey, we tried, but the court struck us down. Oh, darn. I think that's the same thing they're doing with this. Is they're trying to say, we tried as much as possible, and the courts in these evil states did that. The reason why they're having to do that is because Joe Biden has been atrocious at handling COVID-19. Now, some of that isn't his fault. Some of COVID-19 is outside the hands of how government can do it. But, I mean, for all the talk about President Trump and how he handled COVID-19, the reality is more people have died of COVID-19 in 2021 than they did in 2020. And that's all I need to know about how the Biden administration is handling this. And I think this political vaccine mandate is a consequence of that, less it is about public safety or helping people.
Well, the part of the problem is when you take an unconstitutional approach to achieve the goal and objective that you are intending, that doesn't say anything good about your intent if you're having to use unconstitutional methods to get there, which casts a lot of suspicion on other reasons why you're doing what you're doing and the viability of doing what you're doing, which also introduces the vast amount of confusion. The confusion that has been created around all this, I think, is partly due because CMS, and I had it researched. I've got like 3 pages of since COVID began, CMS changing their direction, whether it's mask, unmask, and all those other things. And the confusion that has been created by CMS in the handling of this. And some people can say, well, it's COVID. We've never had this before. We've had pandemics before. We just maybe haven't had this, this pandemic, but we've had pandemics before. And the inconsistency of the messaging coming out of CMS has created a vast amount of confusion and division even within the ranks of our state, whether that be legislator to legislator, medical provider to medical provider, whatever the case may be. The result is, I agree with you. I think he's botched it like he's botched a lot of other stuff, but hopefully in 22 we'll kind of bring that under control. Hey, one thing I want to do, because with the time we got left, I wanted to go back over what we did in ALC yesterday, because I think it's critical for people to understand. So UAMS, DHS, the military, and somebody else, I can't remember who the other one was, came before us because they were under the impression they had to get permission of ALC to invoke these things. The reality is UAMS appears to have jumped the gun and that they put the policy out there, and then they came after the fact to get permission for what they had already done. DHS had sent out a letter, but also it had been retracted and said, we are not. So they clarified that. I do not think, I'm not sure if that was a clerical error, whatever, but I don't think it was intentional. I think it was just somebody slipped up and they sent out a correction letter on that to clarify that. But they were before us yesterday trying to get that. What we as a legislative branch did yesterday, and I brought it out, was, look, if December 5th is the cut date for when you have to get the shot, UAMS had 18% of their employees that were not vaccinated yet. We're sitting here before Thanksgiving. The reality is, how many religious exemptions can you get through? How many vaccines can you get through? You brought it out a while ago that it's not going to be feasibly possible to get all these people vaccinated. Hospital down my area, I think, is sitting with 30% of their employees not vaccinated. The reality is they've waited too late to get it done or to create this pathway forward. What we did in ALC yesterday, and you keep me straight, Trent, what we did yesterday was said, and I brought this out, why are we even having this discussion now if our Attorney General and the legal minds feel that just like the first 2 have been ruled unconstitutional and that stay been put on there, we strongly feel that the third one, the CMS one, is also going to be ruled unconstitutional. And the hope is that he would put a permanent stay on it and it would be nationwide, which would mean that these healthcare providers do not have to force their employees to get the vaccine by the December 5th date. And we said, wait, and we'll come back after the judge rules, and then we'll tell you. That's
critical. That last thing you said is critical. So we found out from the Attorney General office, they will hear this case, I believe, on the 29th, but it's at the end of November. And so that's Attorney General talked about ripeness. Great point by her, because they could not bring these cases up until they actually went to effect. And that's what the Biden administration did. They create this compressed timeline to try to force this in before the courts could say anything, before rightness was there, before it's just basically this legal confusion they set up. So we have a case that will be heard on this, I believe the 29th, but at the end of November at the very latest. So we'll have a few days after that ruling to know whether it was put an injunction on, whether it was allowed to stay, what the status will be. And us as a legislator will have plenty of time to kind of work around and try to get something done in that time to kind of jump through all options. So the legislator, like I said, we didn't punt. What we did was be prudent and not put any vaccine mandates in place because the UAMS are worried about their millions of dollars, and I get that. I don't think it's really going to be threatened. But you know what we're worried about? We're worried about having enough healthcare workers to make it through Thanksgiving as we have this holiday, or have enough healthcare workers who aren't fired whenever they're going home for Thanksgiving and Christmas, and the economic strain that I put on the state. There's all these factors that are real that the best outcome would be basically UAMS holds the position they are without losing funding. And so until we get to that point, I think it was immature. It was
premature.
Premature. Excuse me. Thank you for correcting me. I'm a lawyer, but not all the time. So, premature in doing that. And I think UAMS did that on purpose, to be quite blunt, to kind of put pressure on us to see if we will fold. Thankfully, we didn't. And I think we did it the best way possible. I think your description was succinct and accurate.
Okay, and let me bring out this point. Because you've identified this, and which I brought this to topic yesterday for the discussion in the committee meeting, but Lane Jean made the motion to do that. So thank you, Lane Jean, for doing that. Thank you, Jeff Wardlaw, for recognizing that as chair. And we did work as a legislative body to do the right thing. One thing that employees need to understand is the 29th is a critical date. You want to be praying for anything? You better be praying those judges get it right and they rule this thing unconstitutional, because once they do, then the pressure valve is off. It's crunch time, and it is a big game of chicken. I will acknowledge that, but I think right is on our side. Here's one critical point I want to point out, and that is this. Will the federal government take $600 worth of Medicaid funding away from UAMS and that's not counting everybody else? I do not see that as a realistic expectation. I think that's a smokescreen. But what is realistic is that if you let 18% of your workforce go, or you let go 30% of your workforce, I'm going to say it publicly, don't come asking us for money because you did it to yourself, because you didn't stand with us as a legislative branch and say, we're going to stand united and push back against the federal government. Trent?
Kim, absolutely. I mean, the UAMS and other healthcare providers came to us out of this federal money we got, which we got a large pot of money. A lot of that's been used for good. Let's be honest about it. They came to us and said, hey, we're having problems with staffing, retention, getting these employees that we need so desperately to reduce the ICU beds. Remember, it wasn't a couple months ago we were low on ICU beds. And we as legislative body listened to them and said, hey, here are literally millions of dollars to help you staff and do this. And I think that was the right decision. But now you're going to fire a large part of your workforce with that money we gave you to hire new people. And if you come back to us again saying, no, hey, we can't hire people, I think you're right. I'm going to be very skeptical of trying to take that position after you just let 18% of your workforce at UAMS, or at some of these places, 30, 40% of your nurses go. At some point, that's on you, and we're not going to bail you out of that bad decision.
Well, and the reality is you can't hire who's not out there. That's the reality. You've got to work with what you've got. To me, that's what's so critical is we got to stand united on this thing and push together as a wall against the Biden administration and the insanity that's coming out of Washington right now. We understand what we got to do in Arkansas. As Arkansans, we need to stand together and push back against a crazy government. All right, I'm out of time. Hey, Trent, I appreciate you, man. I appreciate you coming on. And I hope our folks feel better educated about where we are right now. And if you ain't got nothing to pray about, you need to add this to the list, because we got to stand strong, push against it, and we will win ultimately in the end. This is Kim Hammer. You've been listening to The Kim Hammer Show with my guest, Attorney General Leslie Rutledge. Thank you for taking time out. She made time to be on today, and I appreciate that very much. Trent Garner, appreciate that. Breanne Davis, she's driving with 4 kids in her car to her mama's house. She couldn't make it on. I understand that. I just hope you get where you're going safely, Breanne. This is Kim Hammer Show. Go to www.thekimhammershow.com. We'll keep you informed by following us there. Have a great day.
.1 FM. The Answer. KDXE FM. Kamak Village, Little Rock.